This past week, Nevada County received some huge news. The Nevada County Health and Human Services Agency announced a conditional award of $23.7 million through the Behavioral Health Continuum for Infrastructure program to build a much-needed local psychiatric treatment center aimed at increasing availability of critical mental health services closer to home. And here to tell us all about this project is Ryan Gruver from the County of Nevada. So Ryan, welcome here. Glad to have you here with us. Now, 27.3 million said conditional. What's the conditions, though?
23.7 million. It's conditioned on the board accepting the grant and further processing at the state, but it means that we were successful in being awarded this important funding for what is a missing piece in our treatment infrastructure in Nevada County.
Okay. And just so people understand a grant, you submit this grant, you say we're going to do A, B, C, D, E, F, whatever, and that's part of the conditions is that you do spend the money on that. That's the way grants work, right?
Absolutely. It's restricted funding.
Now, exactly what are you going to be building? I saw something in the paper about it, but I'll let you explain it. How's that?
Sure. So what we're going to be building is basically a locked psychiatric hospital. So it's a facility that's going to be located on the Eric Rood Administrative Center campus. It'll have 16 beds that include treatment for what's called a psychiatric health facility, known in county terms as a PUF by the acronym, as well as 8 beds of mental health rehabilitation center. And so that's for acute psychiatric needs and subacute psychiatric needs. So somebody who's in a mental health crisis in our community, if that crisis puts them at danger to themselves or others, then they could have what's called in California a 5150. That's where they're involuntarily confined. Typically they land in the emergency department of the hospital to either be stabilized or if they needed a more acute level of care to be placed in a psychiatric health facility. And right now Nevada County has no beds of psychiatric health facility within our community, and so that means that people are being placed out of county, sometimes significant distances. So in addition to the trauma of going through a mental health crisis, they're also experiencing the further trauma of being removed from their community and away from their family, which are important networks of support for people in that situation. So we're really excited to have this opportunity to bring that service into our community.
Now, when you talked about the 5150, that's a common term. That's a Welfare and Institutions Code section, I think, isn't it?
Absolutely correct, such that when somebody's a danger to themselves or others, they can be involuntarily confined. Okay,
and is there a limit on how long they can be confined?
Yes, when somebody's confined under that code section, they can be confined for 3 days. And during that time, they're either stabilized in place and able to be returned home with a safety plan or to a lower level of care, such as the crisis stabilization unit that we have adjacent to the hospital emergency department for further stabilization. Or if they need further treatment, they can be sent to a psychiatric health facility. That can range anywhere from a couple days to as long as 30 days. And there's a court process for renewing that if it's still needed treatment, since you are taking somebody's rights away to confine them and treat them, sometimes involuntarily.
That's one thing I was going to ask is how long, if somebody could be kept longer than the 3 days, if needed.
Yeah, not to get too far into welfare and institutions.
That's the court that decides that. I understand. This facility you're going to build now, this is so you don't have to send people to Auburn, Sacramento, Yuba City, Marysville, whatever. For that, I don't know if they even have that kind of treatment in Yuba City, Marysville, or Auburn, for example, but I'm assuming they do. And what exactly kind of services would you provide to people there? Will you have doctors? Will you have what kind of staffing will you have there?
Yeah, it'll be intensive staffing 24/7. You're right that we do send people to Auburn currently and further afield, including Yuba County and other adjacent counties. The treatment that you receive when you go to a psychiatric health facility is intensive, around-the-clock treatment. You have mental health professionals who can help with stabilization through medication, as well as other forms of treatment at that site. And on the psychiatric health facility side, those 8 beds, that is more intensive treatment for over a short period, again, trying to stabilize somebody so that they can be returned home with a safety plan or go to that next level of care. And the innovative thing about our project is, in addition to those 8 beds of psychiatric health facility treatment, there's a mental health rehabilitation center component, so 8 additional beds where people can stay for longer if they need a longer term treatment in order to stabilize for up to a year or even more in certain cases.
Now, this is going to be built out by the Root Center, correct?
Correct.
On the where exactly at? Is it next to the jail there, or is it when you first come in? There's that big open lot areas there.
Yeah,
it's
the parcel adjacent to the jail. Right now, there's a garden on one half of that.
Oh, it's kind of the one that's in the back, kind of.
Back behind that.
Okay.
Behind the garden is where it will be constructed, and so it's part of the Rood campus. It is. It's not connected to the jail or a part of the jail, but the proximity to law enforcement certainly is advantageous if that's needed. Sometimes people do have to either go to the ER or they may be in jail, and people can bottleneck because we don't have beds available in other communities. And so being able to have this resource local will allow us to get people out of inappropriate types of care and into the care that they need.
Well, it's great that we're getting services like that up here. Let me ask you this: 23.7. That's to build the facility. Is that also to run it for a period of time, or is that going to have money? Where's that money going to come to operate?
So that money is for the construction of the facility. The initial construction estimates are lower than that, but the grant is to give us space to complete the project. The ongoing operating costs are separate from that, and I should note that we currently are mandated to or required to provide this level of care. We just send those dollars out of the community, and so by being able to serve people locally, we'll be able to redirect those dollars to that local treatment, and so that's part of how we pay for it, is just using what we already spend out of county in Nevada County. Additionally, these are services that are billable under Medicaid. The people that we would place in these types of facilities are typically on Medi-Cal, which is California's version of Medicaid, and so we would be billing the federal government for part of that treatment, and then additional behavioral health dollars would help to operate it. So that grant is just for the construction. It is a really intensive type of facility. It's basically a secure hospital facility.
Now let me ask you, compared to having to send somebody to Auburn, compared to keeping them here at home, is that going to be also a savings to the county?
Yes, running the facility, I mean, it's not cheap to run a facility like this, but when we're looking at the dollars that are being spent, sending people out of county, being able to bring those local, as well as the additional dollars we would pull down, we have analysis in terms of how that compares to current expenditures, and a lot depends on the rates we get for services, like how that pencils and how many people are in the facility in different levels of care. So there's a lot that goes into whether that is break even or it's an additional investment, but where it is an additional investment of new county behavioral health dollars, it's an intentional investment in a critical missing piece of our system.
Okay. So as of right now, conditionally, the county, quote unquote, has not accepted the $23.7 million, but that will be coming up, I assume, on a very soon on a Board of Supervisors agenda. If they immediately approve it and accept it, when do you look at starting to break ground and building this structure?
Yeah, the state is very eager to get these dollars spent and this infrastructure built. So Proposition 1 passed by the voters in March of 2024 is what funds this program. And that aggressive timeline anticipates us commencing construction in December or towards the fall of this year, and completion of the construction by December of 2026. So that's a really ambitious timeline for construction on this scale.
18 months maybe.
Correct, and it could take longer than that. Like, we obviously anticipate that things can change and timelines can shift.
Again, right?
Sure, you never know what's going to happen.
You see. So, okay. Well, I appreciate it. Is there anything else you could tell me about this?
Just how excited we are to have this infrastructure in our community. We've known for many, many years that this was a major gap. We and a lot of counties our size, and especially in our region, are underserved in terms of the number of beds available for this type of treatment. But it was really this combination of this funding opportunity, as well as the creativity of our team, to come up with an innovative model that will work in a small county and that we think we can sustain. And really want to give a lot of credit to Phoebe Bell, our behavioral health director, Director, Ariel Lovett, our Chief Fiscal Administrative Officer for HHSA, and the foresight of our Board of Supervisors. We had an ad hoc committee focused on behavioral health investments, composed of Supervisor Bullock and Hall. And when we started that process, we didn't think a project like this would be possible. And through that process and through the creative work, we're able to bring this to bear. And I'm really excited to be able to expand our level of care for Nevada County residents.
Now, you said that a lot of the other smaller counties in Northern California don't. What other counties are lacking these facilities? For example, does Butte have such a facility? Butte County.
I'm not aware of whether Butte County does, but many counties, I believe they don't. Many counties in our region have 0 beds of this type of care. There's actually a map in the presentation that last went to our board where you can see which counties have treatment beds and which don't. Placer County, which is 4 times our size, has 16 beds. So Nevada County will have 8 beds with the addition of this. And most of the counties to our north, with the exception of the larger counties like Shasta, have 0 beds or a small number of
now,
beds.
will you be accepting out-of-county clients also from
Yes.
other counties? Will they be, like you're right now going to Placer, will you get folks from Butte or Sierra or Yuba Sutter, whatever? Will they be possibly coming over here to put their clients here, or to get their clients treatment, I should say?
Yeah, that was part of our application when the state announced these awards. They announced that this would be a project that would serve 6 counties. So we have 5 other counties that signed letters of support and are interested in potentially sending people if we can't fill those beds. Our top priority would be Nevada County residents getting those beds, and we have built at a level or applied at a level where we think we can fill it with local based on local need. But in the event that there are empty beds, we would attempt to fill those by partnering with neighboring jurisdictions.
What neighboring jurisdictions are supporting you?
Sierra County, Plumas County. I won't be able to rattle off the other
if
3
you give me
off
a
the top of my
rough
head.
idea. Now, are you required? Let me ask you this. Unfortunately, there are mental health issues out there. If the inn is full, so to speak, is there anything that says you have to keep hold back a couple of beds for Nevada County residents, or room for Nevada County residents? Is there a requirement in that respect that, let's say, Plumas County, Butte County, whoever sent 3 or 4 patients, everything's kind of full with out-of-county patients, and we have someone here who needs that service. Is there a requirement that you keep? And to draw an analogy, for example, small rural hospitals in their emergency rooms, they're required to have 2 beds in the emergency room. In case they got one full, they got another one, even though sometimes they don't get any emergency calls in places like, say, Alturas or something like that. But are you required to make sure there's space for the Nevada County residents?
So we're not required to make sure that there's space for Nevada County residents. And really, from a fiscal perspective, I would want to make sure that we're filling every bed whenever we can, so that we can be billing for that. But I will say that, especially on the psychiatric health facility side, those people who are in those are short-term stayers. It can be anywhere from 3 days to 30 days, and so people are cycling through, and so it's not an issue where
there's
you have
a turnover.
Correct. And then we do have, because we have this sort of innovative model of both being a psychiatric health facility and a mental health rehabilitation center, we have the ability to flex between those 2 levels of care. So if we need an extra bed of psychiatric health facility and we have one available on the MHRC side, we're able to do an extra bed of psychiatric health facility.
Was there anything else that you want to share with us about it?
No, I think that about covers it. So
All right.
I appreciate
I'm glad we could.